Health officials in California are urging people to get a COVID-19 booster shot as Pfizer seeks authorization from the FDA to be able to give them to all adults. Dr. Malathi Srinivasan from Stanford Health Care joins us now to talk about that. And Doctor, thank you for joining us.
Amanda, thank you for having me.
Yeah, so do you think that's a good idea, all this going on, especially with the winter months ahead, or are there any potential downsides that could outweigh the benefits?
You know, the COVID booster is safe and it will save your life. And once again, Pfizer is the first out of the gate with the new vaccine data, which shows that the booster reduces your chance of getting COVID by 95%. And this is based on a study that they just did of 10,000 people who were, adolescents and older, so 16 and older, and they who had gotten the booster about 11 months after their first series. So they followed these people for about 2.5 months and found that of these 10,000, if you did not get the booster, 109 people came down with COVID, but if you got the booster, only 5 people did. So it was effective for all ages, races, ethnicities, gender, and medical conditions. So it's incredibly safe. It's very effective. And what I will tell you is this. If you're planning on getting the vaccine booster, give yourself about a day, day and a half, because the majority of people are getting, kind of like mild flu-like symptoms as the immune system revs up. So they're having some site injection pain, a little bit of fatigue. Some people are getting fever and some muscle aches, but the majority of this goes away within 2 days. So there's very few of the serious side effects, which we know are present with the mRNA vaccines. And it overwhelmingly will help you stay safe and not sick through the holidays so that you can really enjoy yourself with your family.
So similar side effects to what we saw to getting our first set of shots.
Exactly. It's not any different.
Okay. Well, do you think we could see another significant winter surge this year? We saw it last year, and it was a big problem.
Yeah, Amanda, winter is coming, and the winter surge is coming unless we all take collective action. Now, I know that you and I probably both want to leave our masks behind, but seriously, this is where we have to double down. England is already seeing the effects of cold weather, and with people being less careful, more hospitalizations, more people getting sick, more community spread. And in California, our rates are already starting to tick up again. We're at 2.3% for all COVID cases being positive of people who are getting tested. And the governor is already planning for out-of-state hospital staff to be flown in so that we can have sufficient coverage of our hospitals, because we are expecting people to be a little bit less careful. And we're hoping that that won't happen if people, again, just do what we can to be able to stay healthy and safe through the holidays. So getting your flu vaccine, getting your COVID vaccine, thinking about some of the oral medications, and following all of the standard precautions that we have been following for the majority of this pandemic with social distancing and mask wearing. So please, it's so much better not to get sick in the first place, and let's all be careful together.
And Pfizer says its new antiviral pill is effective in treating COVID-19. Is this something that could be a substitute for the vaccine, or do you think we will need both?
So the Pfizer pill is a combination pill which reduces hospitalizations by 89% with no deaths. It's incredibly effective. The Merck drug reduces hospitalization by 50% with no deaths. And there's a tried and true antidepressant called fluvoxamine, which reduces hospitalization and deaths by 30%. So it's not a no death category, but it certainly is effective, and it's generic and it's inexpensive and easily available. So the Pfizer oral combination pill is a medication set of two things, like a tried and true medication called ritonavir, which we've been using for HIV for years, and a new medication that stops an enzyme that helps to build the RNA, which is part of the genome of the virus. And so it inhibits it so that the virus particles can't replicate. So you take the pills for 7 days. And when they studied about 12,000 patients in the US, they really saw an 89% reduction. And so what that means is that when they looked at 3 days, for instance, of the people, there were only 3 people who had hospitalizations with no deaths. And again, in the placebo group, there were about 27 people who were hospitalized with about 10 deaths. So this is a pretty remarkable difference, 3 versus 27, with 10 deaths versus no deaths. So again, the problem with this medication and the medication with Merck is that the total distribution is going to be limited. The government has only purchased 1.2 million doses of the Pfizer medication, and they have kind of maybe an on-call 3.5 million. But with a number of people that we think are going to get infected, that's a gross underestimation of what we need. And similarly, the Merck pill, which is called molnupiravir, we're expecting to have about 10 million doses over the next year, but that's really for the whole world. It's not just for us. And so there's going to be limitations in who's going to be able to get it. Fluvoxamine is going to be much more easily available. Again, it's a tried and true old antidepressant, which is mildly suppresses the immune system, so you don't get that exaggerated response that causes the hospitalizations and the deaths. But again, it's not as effective at preventing hospitalizations and deaths as these other two medications.
Okay. And my last question for you is the latest high-profile figure at the center of vaccine misinformation is Aaron Rodgers. So how much damage does that cause when someone so popular speaks out against these vaccines?
Aaron Rodgers' behavior is so disappointing. When role models speak, people listen. And when role models like Aaron Rodgers, who's been such a hardworking quarterback for the Green Bay Packers, speaks untruths, they not only put their friends and family at risk, but they really impact everybody who's believed in them. I mean, first, he lied by omission about getting vaccinated. And second, he's been suggesting that people are dying in large numbers of the COVID vaccine, which is absolutely not true. So the role model platform is incredibly important and has a convening power. And people who've earned that power, like Aaron Rodgers, should use it much more wisely and really hold themselves to a much higher standard. And if they're going to make statements outside of their area of expertise, they really should get accurate information, in this case from medical professionals, before making unsubstantiated and fraudulent claims. So it's been very disappointing to see someone who I've admired behave in this way. So I hope that the people who believe in him will still believe in him for his amazing role as a quarterback and for what he's brought to the sport. But we'll listen to the people who are experts in the field about what to do about their health.
Some good information there. Dr. Malathi Srinivasan with Stanford Health Care. Thank you so much for your time.
Okay, thank you so much, Amanda. It's great to see you.